part of this focus group and helping out was really, really, really amazing because it shined a light on something that my friends have kind of like shied away from. We all get together, we have a tight family, I would say, but we never really talk about issues that are really serious. You know, we talk about surgery, we talk about hormones, we talk about everything that we can do to physically change ourselves, but we never talk about society and the reflection that it does, you know, how it affects our lives. And it was really it was important to be part of it because that's when my friends decided that we need to take this to another step. So we started our own trans group. It's called Twirl, Trans Women in Real Life. And it's just a group that we put together ourselves, and we're doing a lot of stuff. And it's bringing a lot of issues that we would like to overcome, and it's a lot of information. And I'm really proud that Twirl kind of came out of the trans focus group. So I'm really happy to be a part of it. Twirl?
Oh yeah, exactly. So, well, the other thing that we wanted to do, just to know, is this was a focus group that was held in English, and we would really like next year to do a focus group with Trans Latina women in Spanish who primarily speak Spanish, or that's their first language, to kind of compare the information, and obviously support groups like Twirl in their initiatives. So now I want to invite Reyna Oritz, Alexis Martinez, Dr. Margo Bell, who's here, and Maya Lozano to come up. Oh, I think Maya's leaving. So, but that's okay. So we can, and Greg is also going to sit here. If you have any questions, really, I just wanted to kind of have a conversation about really what is next, or what's going on in the trans community that we can all be a part of, that we can all engage in the work. So, yeah. It's really warm, I understand that. So, yeah. So, maybe you can just introduce yourselves and what you do.
My name is Margo Bell, and I am a physician primarily at Stroger Hospital. I'm a pediatrician, but my focus is adolescents and young adults. And as part of that, I focus on LGBT healthcare. And we actually started a clinic specifically for LGBT healthcare. I also work in the community and have a small clinic on the west side at an agency called Task Force, where it's absolutely targeting LGBT youth who come from that community.
Okay. I'm Reyna Oritz. Like I said, I'm a volunteer at Vida, and I also am now, me and a couple of my girlfriends are in charge of our group, which is called Squirrel. And basically the point of our group is, we call it the girls. The girls getting together and exchanging information that can help the girls. That's basically it.
Alexis Martinez.
I'm Alexis Martinez. You know, I belong to a slew of organizations. What got me into this whole movement was the Dyke March Collective, which I'm a core member of, but also TGIF, I'm a co-founder with Kokomo, and you know, here's just I'm a staff member at the Trans Life Center, the Chicago House. But my biggest job is taking care of my two granddaughters.
Hi, so I'm Greg Van Hyte. I don't know if there's anything more.
Other than, yeah. So, well, you're up here because people might have questions for you.
Yes.
I did want to just maybe ask what were some things that you felt that you would like to see from this report? Like, what would you like to see happen? Anyone?
No, well, personally, you know, the last year I was sort of really trying to dedicate myself to building solidarity across the movement. It's like a big thing where, you know, all the splintering of the trans community. I mean, we're one of the smallest communities, I mean, demographically, but I mean, you have I imagine there's groups for tall trans women and short trans women, and all. And, I would just, and every difference, we have to learn how to overcome those differences so that, we can work together as a unified force.
Yeah, sure. The same, something that could come out of it is just us as girls, the transgender women as a whole, to take control of the situation. And I think in order for things to change, we have to decide as trans women that there should be a change. If we don't push for a change, nobody's going to push for a change for ourselves. So I think the focus group brought to me the most important thing was just unifying, coming together, and realizing if transsexual women don't take control of the situation of discrimination, of a lot of hatred towards the society has towards us, it's never going to change. So that's the purpose of, I hope that's what comes out of this, is just giving information and the girls unifying and realizing that we are worth it and we deserve more than what we're getting from society.
Yeah, I'd just like to say that in my learning how to care for the trans population, it's been a true learning experience. And everything that you had in your report, I've totally learned it. And I've had that experience, so I know that it's all true. And so one of the things I don't know if you could take it to this level in terms of getting feedback from providers with your group in terms of asking providers, really asking providers how they feel about the trans population. And of course, then you're gonna need to educate providers. But I think that you definitely hit it on the head that providers need to be educated. So I think your report states that. So.
And one thing that I would just add to that with the providers, I'm glad you brought that up. I think the question and the challenge with any organizational level, like with healthcare providers or with police or with schools, trying how to get in the door, I think is a really big challenge that we've come up with against that in terms of the project. We have this great intervention, we have people that are open, and we've been in organizations such as Catholic Charities to talk about sex and gender and HIV. But how do we get in the door at some of these places? I think is a question that I'd love more direction on.
Yeah, I think one of the things is that providers are probably afraid to let you in the door just because of the subject. And so everybody's a little bit like, I'm not going to do it, I'm not going to do it. So I think finding that right provider to open the door, like me, would totally let you in. And they've been asking me at county for actual education. And I was planning to put something together. So I think that we could work together to put this together. So for a lot of county across the board. I haven't found adult providers who actually are doing trans care county. And I've got my colleagues on board in terms of taking care of trans individuals. So we're getting there. So I think that you guys can definitely get in the door there.
Yeah, there's some models to follow too, like Portland, they provide full trans care, health care in their city employee health insurance. There's several insurance companies that are starting to provide the health care. Mm-hmm. And I think part of the process here in Chicago, like I'm with Pride at Work, mm-hmm. and we just started forming, like a committee and everything to start approaching some of the unions mm-hmm. About attempting to include trans health care in their insurance policies for their employees. It's a much, you have to convince the insurance companies that it's much cheaper for them in the long run to give full health care, including surgeries and everything, because a lot of trans people experience psychiatric problems and drug addiction problems and everything that end up costing the government far more money than if they just help people transition. So there's actually statistics that City of Portland, they had like a 1% jump during the first 3 years, you know, in their insurance costs. But after that, it tapered off because there's only a very small number, you know, demographically of trans people that want full surgeries, and
Right.
you know, so it really is something that it can be approached, but you have to make the connections, and that's part of the bridge building that I keep trying to emphasize. There's people, you know, I call them the gay establishment, that we need to start like hooking up with and connecting, you know, whether or not we like them personally or not.
Well, just so you know, I'm not with the gay establishment, but we do have a wealth of information here. You know, we have the Commission on Human Relations. We have the town clerk of Cicero. You know, we have Powerhouse Media, Windy City Media Group. There's so many ideas of things that could happen, right? If we all just work together on like an issue like that are being presented. Does anyone have any ideas or questions for our panel?
Yeah, Frank David, I'm a trustee at Moore College and also a member of the sister Reyna Oritz. I wasn't aware. Does insurance companies and hospitals discriminate against gay and transsexuals?
Oh yeah. I'm giving you an example. I have a Blue Cross and Blue Shield through my wife's insurance policy, and she works for the city of Chicago. And 5 years ago, I had a mammogram, and they charged me $180 for it. They refused, you know, they said, you're a man, you can't, you know, we're not going to do it. So I ended up paying for it. This time, they charged me $25 as a deductible. So it's changing little by little, you know. But estrogen treatment, any other surgeries or anything, they will not cover. There is Kaiser Medical has several insurance policies that are trans inclusive.
What about like conditions like diabetes or you know, other?
And then, well, that's another thing too. Sometimes, if I get a cold, the doctor's connected to my trans. Anything.
You know, like pneumonia, diabetes, cancer.
And almost every time that I have a problem and I go to a doctor, you know, they relate my whatever the problem is to my taking estrogen. Now I'm 64 years old, so I don't know, you know, what that has to do. There's no scientific evidence that that's what it is, but the medical industry, you know, works that way, and you know, we need to sit down and, you know, at the table with them. Unfortunately, that's the only way it's going to change.
And one of the things that is in the report, I don't know, I don't think it was mentioned, with the whole like or employment discrimination, right? Like, it's not that literally people they just won't call you back. That's literally what it was. They won't hire you. Period. Go ahead, Rosa.
Hi, I'm Rosa Martinez, and I'm a founding member of CALOR. I'm currently the assistant director, and I'm glad that you brought up that topic of employment, particularly as it relates to next steps. I wonder what are we doing in terms of getting a group of highly educated people out there that you can hire. We're moving to, I started CALOR like 20-something years ago, and back in the day it was volunteers, but now we're moving into an atmosphere, an environment where grantees ask you to have people with bachelor's degree and things like that. And it's very unfortunate that sometimes you're trying to hire people and they don't have that type of education. So what is it that we're doing to make sure that, yeah, you want to hire people that are representative of the communities that you're serving, but you don't have the people that are qualified to fill those positions?
Personally, I find that one of the problems with grant-specific jobs is that that's exactly what they do. You know, many of the trans women would probably be excellent at the jobs that are there. You know, but they don't have the educational background to meet those, you know, those requirements, so they won't hire you. So you end up getting, basically, and again, you end up getting a lot of white trans men, or, you know, genderqueer people in these positions that are very powerful, but they have they're very sympathetic. They don't have the experiences that these girls have. So, you know, they they're still using sociological models and everything. They're just completely out of whack with reality.
We have room for 2 more questions.
I was just wondering about just doing sort of a wider sort of net of just doing more education around in community settings, because I think it is sort of that one-on-one connection. For example, I'm with Erie House. I direct the Adult Education and Workforce Development Department, and I can tell you within our department we have a Proyecto Cuídate, which is a Take Care of Yourself initiative, and it's about training women just on leadership and stuff and things like that. But we have a space where we have a health education fair every year, but at no point I don't think anyone has either approached us or we haven't approached the right people. But I think spaces like that would really sort of be an avenue, because in addition to having the health fair, we also have workshops happening simultaneously, and people sort of sign up. And we always have a house full. We've attracted to like 250 people sort of on 25th and Keeler. That's where our satellite site is in the village. So this is perfect. So I already identified like 2 places. I also teach a course, Introduction to Social Work, where I was just covering sort of gender identity with my class in the last few weeks, and they're really confused about it. And of course, this is just an introduction course, and this is one piece of like the chapter, and I can't go into detail about it, although I would love to. So I mean, I could provide a couple of hours, maybe an hour of space in my next couple of classes. So just ideas.
I think that's something that we've talked about as well, like getting together at our group and coming up with something to educate people, getting groups of my friend's a teacher, and we talked about getting a couple of our friends together and just give her like a very general description or just information on trans life and any questions that they have. I mean, I think the purpose of our group is to really educate everybody on transsexual, transgender issues, because they're so confused about it, you know? So I think that's something that I would love to do. I mean, all I really want to do with Twirl is just educate, give people the correct information, and let them leave knowing, you know, better information on transgender issues.
One more?
I'm just wondering, is there existing or could there be a sort of a business initiative so that like a Chamber of Commerce or some kind of directory where like people can frequent businesses that are either trans-owned, trans-friendly, that, you know, that hire trans individuals, so that, you know, it's a way that kind of puts some money and some economic power behind the initiative. So are those businesses already identified, either locally or even, you know, national companies?
No, not to my knowledge.
Would that be useful?
Absolutely. You know, again, the Pride at Work, we're just to try to build a framework of linking up, you know, with different corporations and trying to go after like entry-level jobs, you know, for a lot of the young trans people is very important, or for persons like myself, because, you know, the movement is very youth-led, you know, but I have a wealth of experience over the years, you know, but very limited opportunities to get jobs unless they're inside the LGBT community.